Hello everyone, it's Neil here from singlebestanswer.com. I'm back again with another question to help you pass your UK MLA exam or your PLAB exam, or if you're just revising throughout medical school, head over to singlebestanswer.com to find a great revision resource. Today we are going to look at a 28-year-old woman who presents with recurrent headaches. For the last month, the headaches are extremely painful and occur all over the head at random times. So we know there are associated features that she feels very sweaty, flushed and anxious during these attacks, and the heart rate is fairly high and the blood pressure certainly is raised. So we're asking the most likely diagnosis, looking for the best answer here. Can we find something to tie everything together? Is there something in your mind that would pass the cover test where you don't look at the answers? Well, first thing I would say is that this is a young woman and she has hypertension. Hypertension in young patients is unusual and needs investigating. And there are a handful of causes for hypertension in the young, one of which is a pheochromocytoma releasing catecholamines. This would fit with the presentation. Patients tend to feel very anxious, impending sense of doom, perhaps even with palpitations, sweating, dizziness, and they can get headaches, of course. So that is our single best answer in this case, option D, pheochromocytoma. As usual, we're going to quickly go through the other options to make sure there's not a better option out there and to exclude the others also. So option A, anxiety-related tension headaches. This is really a diagnosis of exclusion and wouldn't explain the hypertension in the young patient, although we have to be careful because if they're anxious and they're getting white coat hypertension, then this can increase the blood pressure when you measure it. Best thing to do there is ask the patient to measure it at home and bring in some recordings. What about option B, a cluster headache? Well, the history for cluster headache is very different. They often get a severe pain behind the eye, occurring in the middle of the night, associated with smoking. They may have some lacrimation of the eye or feel some fullness in the ear as well. So a very different type of headache altogether. Option C, migraine. You should know what a migraine presents like. It's often a unilateral headache, very severe, sometimes with a prodrome beforehand, such as your classic zigzag lines or an aura of some sort. And afterwards they feel very unwell, very tired, then they need to lie down. And what about lastly option E, subarachnoid hemorrhage? Again, the presentation is completely different. They will have a severe headache, a thunderclap headache as it's called, right at the back of the head. Worst headache they've ever had, very sudden onset, and may be associated with meningeal irritation, such as neck stiffness as well. So option D is our best option and it is the correct answer. For a full explanation of the question, head over to singlebestanswer.com where you'll find a whole host of questions just like this. I hope that's helped with your exams, and I'll see you next time on the channel. Subscribe to our channel or head over to singlebestanswer.com and subscribe there. Good luck, and I'll see you next time.